Hello, this is Dr. Tapaswi Krishna, consultant pulmonologist, Gleneagles Global Hospitals, Laktikapul. So today let us talk about all the seasonal flus that we as pulmonologists are seeing on a day-to-day basis and the precautions that asthma and COPD patients have to take in case they get any acute respiratory illnesses. So firstly, after COVID, after 2 years of home quarantine for children, they were all going to school for the past 6 months. So children, there's been a spurt of bacterial and viral infections which we are seeing because they have not had their regular vaccinations, one because of the lockdowns, and second thing, usually when children go to school, they get exposed to various bacteria and viral infections for which they tend to be immune. But the problem nowadays which we are seeing is the child is getting infected almost twice a month because they're getting exposed to new bacteria and virus at a lesser time and more frequency. And they're potentially carrying it to their grandparents at home, and that is where they're ending up with us pulmonologists. So right now the need of the hour is, let us go ahead and vaccinate the children and patients aged over 65 and over 50 who have comorbidities like diabetes, hypertension and coronary artery disease, patients of renal, liver and lung transplant. These are the ones who have to be vaccinated, absolutely. So apart from this, coming to asthma patients and COPD patients, winter months, especially up till the end of February, is the time when they tend to have these asthma attacks and COPD attacks, especially what we call as infective exacerbations are at a rise. So infective exacerbations are mostly because of strep pneumoniae. So pneumococcal vaccine is a must for asthma and COPD patients. Please meet your pulmonologist or your healthcare provider for further information about when you can take the vaccination. Apart from that, influenza is very, very common in children or in older age groups. It's worthwhile to go ahead and get yourself vaccinated with the tetravalent vaccine which is available now, which protects everyone from the frequent upper respiratory tract infections which they get. Asthma patients have to be very careful nowadays, and they have to adhere to their inhaler which has been prescribed to them as maintenance treatment, because any attack could land them in the hospital or in the ICU, because the cold wave is way worse right now than it was in the preceding years. So asthma patients have to go on regular medications, have to do their exercises which they have to take care of. They have to take care of their diet and nutrition which should contain a high protein diet. Apart from that, they have to do their regular vaccinations and their regular pulmonary function tests, which will help the pulmonologist decide if they have to upgrade the inhaler or downgrade it. So now coming to COPD patients, first dictum, please stop smoking if you still are smoking in spite of knowing that you have COPD. Please update your vaccinations with your pulmonologist, which include your pneumococcal and influenza vaccines. Please take a high protein diet because COPD patients tend to keep losing protein, especially when they have lot of sputum. Thirdly, they have to take their regular medications, oral medications as well as their inhalation medications have to be spot on, especially in case of COPD patients. Apart from this, they have to do their regular doctor visit and check for their pulmonary function tests, do their respiratory physiotherapy and rehab on a routine basis, because COPD patients, especially people older than 60, tend to have muscle wasting and loss of lifestyle, their regular lifestyle, because of their breathlessness and loss of physical fitness. Apart from that, please go ahead, take your pneumococcal influenza and COVID booster vaccinations, so that as it is, because your lung health is compromised, any infective exacerbation might cause a heavier load on the lungs. Coming to children, whatever vaccines have been missing in children, especially because of the lockdowns, if they're not up to date, please visit your pediatrician. See that your child is up to date with the vaccination, and kindly follow mask, 6 feet distance, and your hand hygiene. Even now it is very important. Even if there's not many COVID patients which we are seeing right now, it works for other viral infections also. Respiratory hygiene is very important for us to go ahead and implement it in our daily life to prevent other viral infections which tend to take over nowadays. So children have to be educated about their nutrition, their cough and sneeze etiquette. They have to be taught to sneeze or cough into the crook of their arm so that they don't infect other children. If your children are running fever or have cough or sneezing, please intimate your school teacher and don't send them to school.